Hello. It's great to be here in this roundtable discussion. Industry experts with me here will talk about what they are doing to help women overcome healthcare roadblocks, find the right care, and encourage women, to better prioritize their well-being. Let's start with introductions. I'm Becky Allen, VP of Product Development at Healthgrades, and I'll turn it over to each of the panelists to introduce themselves, their organization, and a brief overview about their brand and your markets. Thanks, ladies. Angie, do you want to kick us off?
Sure. Thanks, Becky. I'm Angie Austin. I'm the Vice President of System Marketing and Brand Strategy for University of Maryland Medical System. We're a statewide health system in the state of Maryland, as our name implies. And we have 11 hospitals and over 150 outpatient locations throughout the state.
Great. Karen, you want to pick it up?
Hi, my name is Karen Kruger. I'm an AVP of Service Line Marketing for Virtua Health. We are located in Southern New Jersey, directly across the river from Philadelphia. We market to our primary communities, are Burlington, Camden, and Gloucester counties, although about a year and a half ago, we entered into an academic affiliation with Rowan University, extending our reach and establishing the Virtua Health College of Medicine and Life Sciences. I'm very pleased to be here and chat with you ladies today.
Thanks, Karen.
Thanks, Karen. My name is Kirsten McQuiller. I am with Premier Health. Premier Health is one of the largest private employers in Dayton, Ohio, and the largest healthcare system in Southwest Ohio. Our mission is to improve the health of the communities we serve with others who share our commitment to provide high quality, cost competitive health services. We have more than 13,000 employees who each play a vital role in our organization. As a marketing strategist, I handle women's and cardiovascular services. I utilize an agile marketing platform, and I use a lot of research and analytics to develop, implement, and measure all the marketing campaigns. Many of our campaigns that we implement are B2C with tactics such as pay-per-click, search engine optimization, social campaigns, billboards, and minimal print.
Wow, ladies, there's a lot going on between the three of you. Thank you so much for joining me and Healthgrades today and taking time out of your busy schedules to talk to me and your peers about women's health. After years of pandemic-related caution, patients are finally, we hope, catching up with delayed appointments and regular checkups. Yet women are still neglecting potentially life-saving preventive care, as we can probably all relate to. The recent Healthgrades study found that many women continue to focus on being that household healthcare advocate. So we're great at that for our loved ones, but not so great at taking care of ourselves. So even though we're seeing women's confidence in going to the doctor returning to nearly pre-pandemic levels, our study found that over half of women, about 55%, still skip, the needed preventive care in the last year. Angie, did you also see women's attitudes towards making healthcare appointments and access to care change?
We have experienced that as well. That's not a surprising metric. And I think there are a couple of factors that are driving to that. One is that, we all know that traditionally women have been the healthcare decision makers for family members, loved ones, and we're not the only ones who have been delaying care. And so a lot of the focus has been, presumably on helping those family members get connected to the care that they need. And women oftentimes are putting themselves last in that. And so it's just taking a bit longer to catch up. We also have had some significant access issues across our system in the ambulatory space, primarily within our primary care, internal medicine, family medicine, and women's health specialties. Just not enough appointments for new patients. And so I'm sure that that's compounding some of the challenges. One last sentiment I think that women are probably experiencing coming out of the pandemic is that we are, and as your data suggests, women are in some cases more focused on health and keeping themselves healthy. But I think a lot of that focus is around general wellness. So healthy diet, exercise, women are finding greater balance between working from an office and perhaps a hybrid work situation. And so we're more focused on that overall health and wellness. but oftentimes the conversation of healthcare and actually getting those physicals and those regular checkups are not really part of that conversation. And so I think we as marketers have an opportunity to add that into the mix and to make that connection for women in our communities, that being healthy and well day to day also goes hand in hand with making sure your senior provider regularly getting the checkups and screenings that you need.
I agree. And we've faced similar issues just in terms of access when you consider capacity, especially in subspecialty areas. When I think about female pelvic medicine as a subspecialty in particular, we have seen that getting better. I mean, that's part of the fallout of COVID, and the burnout of providers is really dictating some of that access and being able to get appointments in a timely fashion, certainly at primary care as well. We conducted research in 2020 as people were considering returning to care, and really we're trying to listen to women and focus on what is important to them. And I know some of the research talks about women and having them, the importance of them being heard and focusing on that area. So we have launched over the past 3 years a brand campaign that is focused on educating women and really helping to drive the fact that self-care is not selfish and they have to prioritize their care. We all know even the best multitaskers aren't good at that. So we have a lot of avenues that we pursue in terms of campaigns and really delivering those messages through our CRM and really enhancing them and having them feel comfortable that it's time for them to take care of themselves as well, right? You can't be a provider, a caretaker, or somebody else if you're not taking care of yourself.
On the other side of that, for Premier Health, here, what we experienced is very minimal reduction in our women's and OBGYN services appointments, especially pregnant moms. They maintained their obstetric appointments despite COVID. However, reporting that we provided to our stakeholders uncovered that while we maintained the existent patient base cadence, there's an opportunity to actually capture those women in our markets who have no preference or no confirmed OB-GYN specific. With COVID, that gap became even greater. So what we are focused on here at Premier Health is focusing on acquiring that potential patient population with women taking their healthcare more seriously. We've employed an increased spend in all of our marketing campaigns for awareness towards access with our physicians. Most of the decline that we did see was for urogynecologic procedures and pelvic and bladder incontinence outpatient surgeries. Those were delayed, but there really was no gap in between services. And not all women pushed their care. Majority of the ones that were having the more urogyn issues kept them because they know those procedures were vital.
Kirsten, just to take that a little further, when you saw those appointments continuing, did you see any issues that was preventing women from committing to their health checkups, that preventive care and things like that?
Yes. So in terms of women preventing having commitment issues, that's what I call it, a commitment issue. We found that key access is the key to attracting new patients, but also retaining them. For new and existing patients, we have access for OB-GYNs within 3 to 5 days. We also have a great menu of women's services that we provide with physicians, nurse practitioners, midwives, physician assistants for access. Our access here is 87.7 compared to the national average of 66.7. So I think we're doing very well. In the meantime, there are many social determinants of health to factor into the women's inability to commit to healthcare. Here within Montgomery County, there are many social determinants at play. One of them is transportation. Another is racism and biased racism in healthcare. And women are more accustomed, I think all of us can understand this, we are more accustomed to disappointing ourselves in healthcare with our appointments than our children or our spouse or our loved ones. So we kind of take the hit, as we all know, and delay that care. And that is something that really we have got to stop doing because it causes barriers. And there are several barriers. There's economic barriers. And there's also just regular everyday social determinant barriers. So it really just depends on where you are and what you can do to kind of mitigate that.
Angie, did you also see this, as women having these commitment issues or similar type things that were preventing them from getting those regular health checkups?
Yes. I think that I agree with everything that Kristen has said. I think there are those standard, it's a mindset, right, that many women have. And again, as she said, not to really restate everything that she stated, but putting ourselves second, putting ourselves last is a, pretty common, I think, behavior that women are experiencing as it relates to accessing care for ourselves. The other area where I think that, and again, this is tied a bit to the pandemic, is the connection between physical and mental health. And so there's an increased focus on the need for greater access to mental health services. But oftentimes we're talking about those things in silos. And so creating that greater connectivity between the mind and body, taking care of the whole person, helping women to not have to prioritize one part of their health at the expense of another part of their health, I think is a really important focus for us as healthcare providers to put some attention to, so that it's not so difficult to get the care that you need, recognizing that you may need services in a few different areas. It makes it a bit easier to access the care that you need in a more holistic and comprehensive way by breaking down some of those barriers and silos that exist today within our healthcare systems.
Agreed. And I think where we see a great need and have been taking new approaches is with maternal health, certainly talking about peri and postpartum depression and those behavioral health services, and really creating resources and environment, expanding our operations to be sure that we are covering that and considering those unique needs to really address those concerns.
Karen, just to take that a little further, how are you engaging with women, especially those who've deferred care and building loyalty around that care?
Yeah, when we talk about that, and Kristen brings up a good thing about thinking about acquiring, new patient base versus your current patient base. One of the things that we have been doing, and I think I talked about it a little bit, is a lot of research behind and engaging. We have a multi-channel consumer marketing campaign that is really designed to drive awareness of how we are here for women in every way possible. And that's thinking care outside of gyne services too. We have tertiary care in cardiology and women's cardiology, think about that, and GI and orthopedics, and really just how women are impacted differently than men in many ways, and driving them to make sure that they're taking care of those needs as well. What we found to be particularly helpful to help to overcome and foster that return to care, we've leveraged a lot of data from our CRM and our patient database. We utilize programs that we develop propensity models with our CRM partner in two specific areas, thinking particularly about female pelvic medicine, so developing models and outreach to our customers who are likely to need our urogynecologist for pelvic floor disorders and such, and enacting them to be able to take that step. And then the other area that's been particularly important for us in talking about delays of care and getting back to routine is around mammography. So identifying people who have put off that care and reaching out to them and then driving them to that necessary screening. We all understand the importance of those screenings, and we've been very focused on that. And we have been able to really return thousands of women to that care, to that mammography. We see cancers that we found that really are impactful, and we know we're saving lives in that way.
Becky, one of the opportunities that we found to engage women and motivate them to prioritize their own health care is to make it very effective and convenient for them. The healthcare market, as I see it, is very retail oriented. And as the leaders in the home, many women want things to be done the most efficient way possible. For example, many women utilize their mobile devices to order food, retail items such as Amazon and other platforms. And we've embedded our pay-per-click and our search engine to direct them to schedule their appointments online with their mobile device. For those women who have no preference or no physician, we recently launched a Find Your Perfect Match OB-GYN. This allows prospective patients to answer a series of questions pertinent to their care that they would like to receive, including physician type, location, first availability, and more. I kind of compare it to a dating site without being catfished. A lot of women survive and thrive by convenience. And as we manage self-care in our households, it is imperative for them to have that as well.
It sounds like not only are you asking, which a lot of us don't do, right, or don't get asked, but listening.
Yes.
That's great. Angie, do you want to add anything there? I'm sure you all you're doing other campaign tactics and messaging and specific things as well.
We are very similar to what's already been discussed, leveraging data to identify women who either are lapsed patients, haven't received the care that we know that they may need based on propensity models that we work with within our CRM to ensure that we're sending the right targeted messages to the right women. I think hand in hand with convenience is making sure that when we are sending messages, we're sending messages that we know resonate and connect on the individual level. And that's really important for building loyalty, for building that stronger connection and partnership with our patients. It's helping them know that we understand them, we understand, where they are in their healthcare journey, and that we're making it easy for them to identify the services that they might need and easily connect with those services. And what we found through our strategies is, and using some pretty simple targeted tactics, is that women are really in need and very, very quick to respond in a way that we hadn't seen previously. And so our click-through rates and conversion rates through our women's health landing pages have brought in significant number of new appointments, higher than what we would typically see with a lead acquisition campaign. And I think it speaks to the fact that we're targeting women and appealing to them in a way that feels more personal, really impresses upon them the importance of taking care of themselves and making it very easy, as Kristen said, to schedule that appointment, to make that request and connect with care. So it's been interesting to see how women are responding, and it just speaks to the need that is in the market.
So maybe just a little bit more, Angie, and then the rest of you, when finding the right doctor who listens, right? It sounds like, Kristen, you really lean into that with your health system, but how are you helping also the women, sort of in particular around listening and knowing that the doctor themselves is going to listen and going to be there in their care?
Sure. So I think, as marketers, part of it is just making sure that we're visible and our providers are visible throughout that healthcare journey. And so regardless of where a woman is in her personal care, not just focusing on women who are seeking, to family planning, right? And really focused on that kind of middle stage of life, but looking at the full continuum of care, and ensuring that we are connecting them with the care that they're seeking all along that journey. And so it's being present across that entire marketing funnel, from awareness through consideration to acquisition. And making sure that as women are seeking that care and actively looking for providers through paid search, through physician finder services, through a Healthgrades type of platform, that we're visible, and that we're putting our providers forward in a very personal and comprehensive way. And so that requires developing assets that can build out a physician's profile and present them as an individual and as a person, and not just as a white coat. And so we want to personalize those messages as much as possible and create opportunities for patients to get to know a physician perhaps a little bit before they make the commitment to become their patient. And so we look at different strategies for doing that. Certainly robust physician profiles on our website and other third-party sites, developing get to know you and philosophy of care types of videos for those digital properties, producing podcasts and vodcasts with our providers to allow them to speak more comprehensively about certain conditions or treatment options that women may be able to seek. And, through that type of interaction, patients are able to get a feel for what that provider is all about, their commitment to care, their commitment to their patients. It really comes through. So I think content is a major, it's a major focus of ours right now within our health system. We're very, very focused and continuing to invest in a robust content strategy. And I think it's that type of content that really makes the difference in terms of helping women connect to providers and feel confidence in the ability to build the relationship that they're looking for.
I concur 100%. The content does drive that confidence and that trust in the brand, and taking beyond and the physician profiles and having that humanizing experience within those videos. We know how impactful online reviews are and the online searches with women. So to your point, Angie, it's making sure that we have all our physicians accurately reflecting their philosophy of care and putting some humanizing elements into those as well. We have really made a concerted effort into developing our patient and physician stories together and putting them out to the marketplace. We leverage patient stories across the board in many different platforms. We have print platforms, magazine, of course, videos, social media, but we find that it's really impactful when we have that physician and patient connection. And that's one of the things that we have continued to leverage through great stories about care and how we've impacted and changed lives. So we think about that multi-channel, hitting everybody from everywhere and meeting them where they are and having messages that really resonate with them. That is one area that we find very effective.
One of the areas that we at Premier Health really maintain and stay committed to is our responsibility to improve diversity, equity, and inclusion in our efforts, not only with our employees, but also with the patients we serve. In addition to access, we employ a very diverse physician landscape. This only enhances the patient experience to have access to interpreters, people that look like them, to prevent not only communication barriers, but plan of care barriers. There's also the uptick of millennials who want to have a female physician. Most of the older generations did not have a preference. Women of color experience way more racial bias, which discouraged them not only to trust their provider, but also know that they are being heard. As a health system, it's imperative that our physicians and providers listen to the patients and address their concerns, no matter how big or small. In order to reduce racial and ethnic disparities, our employed physicians and providers know and practice as it is their responsibility to explicitly factor race and racism into the care that they provide in the communities that we serve here at Premier Health, to eliminate racism and racial disparities that continue to be social determinants of health.
So can I build on what Kirsten is saying, because that is really important. And our First Lady of our state, has a major initiative to overcome bias in healthcare, health equity for women and maternal health. And one of the areas that I'm particularly proud of for our organization, we position ourselves as being here for good, and we have a lot of a lot of things that we do within our communities. We have very vast communities that we serve. We have a mobile fleet, we have a mobile grocery store. We have mobile food markets. And we just launched a mobile health and cancer screening vehicle that will quadruple our ability to provide mammograms to women who are underserved or uninsured. But part of the model of care that I'm particularly proud of that we had the opportunity to launch about a year and a half ago is that we are able to provide a freestanding midwifery birth and wellness center, and really leveraging our midwifery practices as models of care, because that is an opportunity. It's a different model, right? They're really taking the time and spending the time to educate their consumers, and have particularly found that that is impactful, especially in overcoming some of those disparity issues. So that has been another way that we've been able to serve our communities as well.
Yes, and
Karen here. Oh, sorry, Angie.
I'm sorry, Becky. I was going to say I can build upon that as well. And one area of focus that our health system has been very intentionally engaged over the last couple of years is first acknowledging the role that race and racial bias can play in not only our ability to hear patients and take their concerns seriously and ensure that they're getting the right treatment, but actually giving them access to certain treatments that because of the fact that race is considered a factor in some of the diagnosis or treatment options that they just don't have access to. And so our health system has been working very closely with our School of Medicine to ensure that we are eliminating race as a factor in different treatment options and really opening up the door for different communities, I would say in particular, African-American and Hispanic women, and men to gain access to certain treatments. An example of that is with respect to VBAC, so the vaginal birth after cesarean option for women. We have, as a health system, removed and eliminated race as a factor in that, as a birthing decision. And so really creating greater opportunities for women to have the delivery that they would like and not really holding them to the tradition that the previous tool required with respect to having a cesarean for future births.
Kirsten, did you want to add?
I did. Unfortunately, here, our largest county, Montgomery County, has a higher rate of people living in poverty and unemployed in Ohio, which is a larger number than the U.S. average, sadly. Premier Health recognizes that, and it is imperative for us to contribute to a healthy community. So we partner with local clinics for low-income patients, offering and providing both primary and specialty care services to patients through academic rotations by local universities such as Wright State University. And that kind of helps to break some of the barriers economically that our consumer base is experiencing. And through that, I think it allows the community to know that we are actually here to help. And as Karen stated earlier, the mobile clinic, we also have a mobile clinic. We have a mobile mammo. And we try to go out into the community and provide care than waiting on the community to come to us.
Yeah, it's interesting because we have a very diverse population. So we have Camden, New Jersey, which is there's a lot of underserved population there. There's a large homeless population. And then if you want to go further east, we have a lot of farming communities with migrant workers. So that has been really important part of our mission, is to be able to break down those barriers to access. And what you were saying, going out into the community, a very diverse audiences that need different levels of care. So I look forward to having a mobile fleet of like 50 vehicles someday. It's bringing healthcare to people, which is very important.
Angie, do you want to expand on other things in your market, other engagement challenges and opportunities that you're facing, either in the women's area or beyond, and what you're sort of working on in that area?
Sure. So much like Karen described, we also have a very broad demographic that we service, and throughout our market, while we live in a small state, we do have very different demographics and health disparities that we're facing in different parts of the state. And so we have in our more urban settings, very focused on addressing those health disparities that exist primarily within the African American community, and addressing those in ways that I've already described and that others on the call have described. Mobile units are certainly part of the mix. There's a major focus on community health and community outreach, driven by our health disparities reporting that is done throughout our communities. There's a great deal of consistency in terms of comorbidities and disease state across our entire state, but there are increased emphasis in certain areas, given some of the challenges, in particular, just access to care, transportation, making sure that the right information is getting to the right community members so that they can make the decisions and feel confident and trust the healthcare system to deliver the care that they need. Our mobile units are active throughout the entire footprint of our health system. On the Eastern Shore, we service 5 counties. And so it's a very, very broad area, large geography with a small population and not a lot of healthcare options. And so that community health focus is very important to make sure that members of the community are getting the care that they need. They're connected to the providers and getting access to the best healthcare, recognizing that it's a challenge, right, in that rural healthcare setting. There's a real focus on changing the healthcare delivery model on the Eastern Shore, and we're really leading in that space around the development of rural healthcare initiatives.
Is there anything, as you look back across these last amazing 3 years, right, that has changed the world so much, that you're really proud of, that that really changed how you approach your job and your communities every day?
I think I talked a little bit about being able to open our birth center has been a really a great opportunity when we think of women wanting to receive care in different ways, and that one model does not fit every person, and that really provides a different opportunity. We have had a great focus on midwifery care, not just through the birth center, but really in freestanding practices, really aligned to have that extended high-touch care for gyne wellness and birth. So you're choosing your wellness experience as well as a birth experience.
Sort of that continuum of care, it sounds like it's broadened more is than what it was 3 years ago, maybe, that you're thinking about it.
Yeah.
One area that I'm especially proud, and this is really with respect to our focus within the marketing department and how we're serving our communities is, and I've already mentioned this a bit, is our commitment to growing a large and dynamic content program. I do believe that content is the way to, again, build those really critical relationships with consumers in our market and help them understand that we see them as unique individuals. It's not just about taking care of you when you're sick, but it's about keeping you healthy and well. That focus is incredibly important and has been incredibly beneficial to us in our strategies to not just target individuals as we're looking for service line growth, but making sure that we're engaging individuals within our community across that entire healthcare continuum. And when they don't need our services within the walls of our hospital, we're giving them the information and tools that they need to manage their care, manage their chronic conditions outside of our practices and facilities. Population health is a major focus in the state of Maryland. For a few reasons that I don't think we have time to get into here, but it's a major area of focus within our state. And so we're very focused on keeping people healthy, making sure that individuals are accessing the care that they need in the right place, in the right setting, within the right facility, regulated versus unregulated space. And so our content program has really allowed us to educate individuals, give them the information that they need to stay healthy, and then to know where to go to get the care that they need when they need it in the right place that's going to serve them the best. And that, that is something that I'm really proud of that we've been able to build coming out of COVID. COVID was an opportunity for us to really blow out content because of the need for information. And we were able to take those learnings and transition them into a more robust, I'd say, comprehensive strategy now that we've come out of the pandemic.
One of the areas that I think we're especially proud of is within the multicultural marketing that we are now employing. Although we employed diverse marketing before, we really have tapped in strategically to multicultural marketing because of all the taboos that are out there predicated on race. So we found that likeness matters, representation matters. So we made sure that and continue to make sure that our marketing materials reflect the communities that we serve. I know a lot of times many people associate the more African-American community to being underserved, but there are many successful African-American communities. So we can't segment them into one area. One of the areas that we saw grow exponentially here was the Hispanic population. So we made sure a lot of our marketing assets have now been translated so that they can get them and not have to have a translator tell them about services. We also tapped into a personal feel. So we did physician videos where physicians are able to introduce themselves and give a glimpse into their life, what made them go into medicine, especially OBGYN, and where they came from, their background, everything, a personal insight. And I think with COVID, that really resonates with patients because you can't necessarily go to the doctor for the first time and expect to have a connection. And in the videos on their profiles, which are also accessible through our health stream, through Healthgrades, they can see this doctor and experience and get a glimpse into what it could potentially be like to actually have an appointment with that physician.
I love that. That's just humanizing the experience. Yeah, it's very important.
Right. It really makes a difference, right? If you think about just even being on Zoom and really wanting to make that personal connection, it's just harder these days. So it sounds like you all are doing an amazing job at really thinking about others in your communities and your community specific. It looks like there is a question in the chat, so I'm going to go ahead and open that up. And let's see. So being mindful of our time, I'm going to open up with a couple of questions. Let's see, here we go. Can you speak to how you're building loyalty with women once you have engaged and converted them?
Well, I can talk a little bit about that. I think I was talking earlier, and I think Angie alluded to this as well, and really building out content, utilizing our CRM in a couple different ways, not only just to drive awareness and link people to appointments, but also we have spent a lot of time engaging in developing nurturing email campaigns that are ongoing and evergreen, providing different messages of care and lifestyle information to make sure that we are there with the message at the right time. Because we know with women, there's a lot of acute care. It's just a matter of having something resonate, build that brand over the course of time. We also leverage internal communications. I think we have a huge internal audience as well that we want to continue to drive to care and make sure that they are aware of the options for them within our health system. So really that ongoing messaging is very important to us, and maintaining that relationship over the course of time and leveraging our maternity. We have a maternity campaign that parallels our OBGYN journey with an email and text message campaign, and then we pull them through to our women's nurturing. So the idea is really trying to maintain that continuum of care, across the lifetime, and making sure our messages are then targeted for each different age and stage of life as well. So.
Yes, I will just put an underline under everything that you just said. I totally agree. I think, and I've mentioned this already, but content is the way to do that. And it really is about those targeted messages. And I just want to emphasize the importance of the tools that we just mentioned. So the importance of leveraging a CRM, the importance of ensuring that we have strong data sets to reach consumers who don't know us yet and we're not yet connected with, and being able to understand whether or not they are accessing care within our health system, how they're accessing that care, and how we can help to ensure that they're getting the best care that they need based on what we know. And then to just, again, make sure that we're continuing to stay in touch with them. There's a lot of noise, right? There's so much noise digitally. And so breaking through that clutter is, I believe, really strongly done through smart content that engages and really resonates with what women are looking for. So topics that are very timely, that are in line with what's happening in the media, the news media, pop culture, making sure that you're staying in tune with those types of topics that are going to be top of mind for women, and figuring out how do we tie that to our brand and help connect people with more information and deeper information on a topic that might be something that they're interested in or something that that directly affects them. And so I do think that is a really important way of continuing to build loyalty and ensuring that we're investing in those tools that allow us to do that effectively.
I definitely would also piggyback what Angie and Karen have stated as a health system. I think that's kind of the rules that we run by, if you will. Just to add to that, I think consistency is a characteristic of loyalty. And I think if we are consistent in maintaining and cultivating those relationships and being able to keep them going strong at all stages of a woman's life, we would be better off as a health system, and those women are better off. If they are entering the age of menopause, we have webinars that they can attend to have questions answered. Very, very curious as to what my mom experienced, what I experienced, what my siblings, my sisters experienced. Everybody is different. So consistency is key to really maintain and maximize our patient base.
Well, thank you, ladies. This has been an amazing conversation, and I'm so excited to have met all of you and have spent, this time together and some other time together. And I look forward to more time. In closing, I just want to thank you, and thank everyone who's attending this. I just want to thank Angie, Kristen, and Karen, our panelists, and for sharing your insights, your expertise. There are so many layers to solving women's healthcare. And, I think we definitely scratched the surface. And it just sounds like all of you are really taking a lot of time and passion around women's health and around the health of your community in whole. It was great to hear about all the different pieces and ways, not only the women, but each of us, and that personalization and humanization. And just, I'm so proud to have been able to spend this time with you. And I hope that, everyone else on this call has enjoyed the time with us. And I thank you very much for the great work, and keep it up in your markets. It looks like some places I should think about living someday in the future. So thank you.
Thank you.
Thank you very much.